All right, good afternoon, everyone, and welcome to Gentle Movement at Home for Friday, June 26th. I'm Jen Hansen and joined today by Colleen Jorgensen. This is Colleen's third session with us. We're super excited to have her. Just a reminder to everyone that Colleen is not able to provide specific medical advice for your condition. So we do advise if you have concerns or questions that you speak with your healthcare provider who can really assess your situation properly. If you do have questions about this session in particular and any of the movements that we're doing, then we will have time for questions at the end, and I encourage you to put your questions into the Q&A, which is at the bottom of your screen if you're on a desktop. I will read the questions out and Colleen will answer them. We're recording this session so you can return anytime if you enjoyed this series of movements and do them again. And it's gonna live on our YouTube channel, PNBC's YouTube channel, as well as on PNBC's Facebook page. We do have an archive now of over 30 sessions, which is pretty good since the beginning of April. And so we encourage everyone to share those with people you know that might benefit, and maybe return to them during the summer as we are taking a break. Tuesday is going to be our last session. So just another note, we do a little poll at the end of this, as many of you know. If you could let us know what you think, that would be really valuable. And if you have any questions throughout and you want to talk to me, you can either email me at education@pnbc.ca or put your question in the chat, which is actually probably easier. Okay, 2 more sessions. So Colleen's back on Monday at noon, and then Tuesday, June 30th is our last session with Neil. So Colleen, that's all I have right now. So I'll turn it over to Colleen.
Thank you very much, Jen, and thank you again to PNBC. Welcome to everyone that's here. So for today, we're going to be working in seated, and we're going down to the floor today. So I would suggest a yoga mat and or blankets if you want that extra cushioning. For the portion in seated, you can absolutely do it in a chair. I've chosen to come down to the floor today, but it's not necessary for the movements that we're doing. So if you're better in a chair, that's absolutely fine. And we're actually going to be starting with a little awareness practice. So for that, if you prefer to be lying down, go for it. I had a few people reach out to me this week to say that they wanted to come and do this class, but they were having a bad week and weren't sure if they were up to it. It's always, always, always an option that you join the session and don't feel that you have to do any of the movements. You can simply observe and imagine yourself doing those movements, monitor your breath as you're doing so, or you could close your eyes, not even watch, and just listen to the cues. And already that gets your nervous system sort of prepped for perhaps next week you then want to try the recorded version on YouTube. So follow what your body needs today. If you want to jump in on 1 or 2 things, great. If you want to jump in on the whole thing, great. And if you want to just listen, that's fine too. So let's go ahead and start with just what you're going to need for today, just so that you don't have to get things up. So you need a mat. You need at least 1 towel that you can fold. Probably a bath towel is a good size. And I would suggest having 2 of those, and possibly, it's all going to depend on your size. You might want to have 2 face cloths. For those of you who have worked with me before, I work with a lot of balls. If you happen to have balls around the house, you can use them today, but you can do the same movements with the towels if you don't have balls. So don't worry about it. You're not going to be missing out on anything if you don't have balls. So those are your toys for today. Go ahead and set yourself up either seated or lying down. Take a moment to get into a comfortable position, and always take the extra minute to prop your body in whatever way allows you to really just drop in. So if you set yourself up and something's a little uncomfortable, it's absolutely worth it to take a little towel or an extra pillow and just prop under the elbows, the legs, the head, whatever you might need. And then just close the eyes. Just take a moment to arrive here today in your body. Congratulate yourself for taking the time to come and do this class today, to spend the time on you, which we seem to always have a hard time making ourselves a priority, so I'm glad you're here. Just notice the sound and the rhythm of your breath, but without trying to influence it in any way. And then keeping the eyes closed and resisting the urge to move your hands or feet in any way, I'd I'd like you to see, are you able to visualize the outline of your physical body? So if you were to trace your body with a pencil or chalk, could you trace the whole thing and be able to find the form of the entire body? 3D actually. If we trace it, it's only 2D, but imagine in your mind that you would be able to trace the front, the back, the sides, the diagonal aspects. Can you feel, just by thinking about it, where the borders of your whole body are? And then I'd like you to bring your awareness a little bit further outward. So if you're seated in a chair or you're sitting on something, then I would like you to imagine trying to trace the outline of your body and include whatever chair or furniture you might be sitting or lying on. If you've chosen to lie down on your mat, can you visualize how long and how wide the mat is without having to feel it, without having to look at it? You might find that some parts you can visualize very well and other parts are like a black hole, and that's fine. Just notice that. And then we're going to expand our awareness a little bit further. And again, keeping the eyes closed, can you tell where the borders of the room that you're in are? So can you tell how far away the wall is from the front of your body? How far away the wall is from the right side of your body? How far away the wall is from the left side of your body? And if you're not lying down, how far away the wall is behind you? Can you sense, without looking, how high the ceiling is? And one last thing without opening the eyes yet, can you sense whether or not there are objects in the room with you? Now you probably live where you are right now, so maybe you have a memory of the object. So rather than relying on that memory, see if you can just notice, just by feel, by trying to visualize, can you tap into where those objects might be in relation to you? How big do they feel? And how close or far do they feel? And then bring your awareness back into your body. So let's narrow our focus a little bit more away from that room, away from the objects. Bring it back inside your body to bring your awareness back to the sound and rhythm of your breath, just for one cycle. And then gently open the eyes. And we're going to do a breath exercise together. So your choice, if you're lying down, feel free to stay lying down. If you'd like to move to sitting now, you can. You might have noticed that I'm kneeling on an object. So sitting on the floor is a challenge for me. So I've created a little bit of a height and I was straddling it. Another option is to create a height. I'm using a yoga bolster, but you can certainly do the same thing using firm pillows or folded towels. And then I'm supporting my knees, and this is much more comfortable for me than sitting directly on the floor. You also have the option of sitting in a chair, okay? So we're gonna do a sternal breath. So you're gonna place one or both hands on your sternum. If you're lying down, you also have the option of putting something that has a little bit of weight on it, okay? I'm gonna use my hand as the sternum for a moment. So on our inhales, you want to imagine using the breath to push the hand a bit away from the spine and allowing it to tip towards the face. On the exhales, we allow the sternum to sink in towards the spine and slide a little bit towards the feet. Now, I'm exaggerating it by a lot just so that you have something to visually look at. That movement is much more subtle in our body, but that's what we're looking to feel. So go ahead and place one or both hands on the sternum. Eyes open or closed, whichever way works better for you. You're going to breathe in and out through the nose. Try to make the breath long, slow, smooth, and soft. And notice what, if anything, is happening under your hands, under that sternum, under that breastbone. Is there any movement? And for some people, there may not be, and that's okay. This breath will help to create some movement. So you keep going with your breath in your natural rhythm. I'll describe a few things as we go along. So inhales, allow the sternum to float away from the spine and tip a little bit towards the face. Exhales allow the sternum to sink in towards the spine and slide a little bit towards your pelvis or your feet. And this area under the sternum is an area that a lot of us hold quite a bit of tension. It's a bit of a chicken or egg question. If you're someone who experiences sensations of anxiety, that can cause these tissues to be tight under here. But the opposite is also true. If you're tight under here because of habit or posture, that can trigger sensations of feelings of anxiety. So it's well worth trying to soften these tissues up. Let's go for a few more. And see if you can notice, was there a change in how much movement you had under your hands when we first started compared to when we finish? It may not change in one setting, in one sitting. If this is your first time doing this practice, it might take several times before you actually see a change. Let's go for 3 more breaths like this. And I want you to remember this breath because we're going to come back to it a couple of times during today's session. And at any point today, if you need to change your position, you can do this standing, you can do it lying down, you can move to a chair, to the floor, as you wish. Let's go for one last breath. Gently release the hands. If the eyes are closed, you can go ahead and open them. Let your hands just rest on your thighs or by your side. For a moment, I'd like you to just bring your attention to noticing how is your head sitting on the rest of your body. So eyes open or closed, whatever works best for you. And just notice, is your head forward of your torso? Is it lined up right on top of it? Is it tilted to one side? Turn to one side? Just notice how it is, and we'll compare after we do a couple of very simple, very gentle techniques. And then you're going to test. You can go the same direction as me. I'm going to mirror you. So just test, not trying to go to your maximum, but turn your head a little bit towards the right. The moment you feel any kind of resistance, you'll stop there. Notice it. Notice how it feels, how far you got. Come on back. Same thing to the other side. Notice if one side was easier than the other. Come on back. And then tilt right ear to right shoulder. Notice how this feels, how easy it is, how far you can go. Come on back. And the same thing, other side. Is there a difference from one side to the other? Just notice the quality and come back. Now we're going to do a couple of self-release techniques, and we're going to come back to those movements to see if it changed anything. So you're again going to place one hand on your sternum. Let's go right at the top of the sternum where the collarbones come to meet it. We're going to put our second hand on top, and we're putting a little bit of pressure, significant amount of pressure, so that you're not just on the skin, you're not just on the bone itself, but we're actually trying to contact those tissues that are just behind the sternum. And you're going to ever so slightly draw those down towards the floor, just a little bit. So we're lightly pushing inwards, lightly drawing downwards, and that doesn't change. So now we're going to go ahead and tilt the head to the right. Come on back for a second. Rather than thinking of tilting your head to the right, which is what I just advised you to do, instead I want you to picture that you've got a helium balloon hanging from the tip of your left ear. Just allow the balloon to float to the sky, and that will give you just this ever so slight tilt. We're not looking to go to stretch all the muscles of the neck. We're making it much more subtle than that. And then just maintaining this position, you're going to go for 3 of those sternal breaths. So exactly as we did before. But this time, on your inhale, if your sternum wants to float up, you're going to block that a little bit with your hand. So that by the end of the 3 breaths, we're going to sink a little deeper, a little deeper, a little deeper. One more time. Slowly come back to center. You can keep the hand position the same, or you can change whichever one's on top, up to you. Imagine you've got a helium balloon on the right ear. Let that balloon float a little bit to the ceiling. So it's just ever so slightly going to tilt your head. We're not looking for a stretch of all the muscles in the neck all the way down to the shoulder. That's not the purpose of this one. Instead, we're trying to target the circulatory vessels that pass through all the vertebrae of the neck. It's called the vertebral artery. And we're looking to affect the vagus nerve. You might have heard about vagal tone these days. There's a lot of research, a lot of talk about it. I won't go into it so much today, But just to bring your awareness that we're bringing some attention there. Go ahead with your sternal breaths if you haven't already. And again, on your inhales, for these ones, you're going to block the sternum. So instead of allowing it to float up as you breathe in, you keep it where it is. Every exhale, maybe you sink a little further with it. Come on back out to the center. Release the hands for a second. And just do another little test of turning to the right, back to center, turning to the left. Any change in the quality of those movements? Then tilt. Come on back. Tilt. Any change in the quality of those movements? And then we're going to come back to do a similar but slightly different release. So we're going to go ahead and tilt the head again, just with that helium balloon lifting to the sky. We tilt ever so slightly to your right. Come on back, I'm going to change my mind there. I'd like to do a different one. So you're going to actually turn ever so slightly to look to the right. And then your helium balloon is again from that left ear slightly to the ceiling. So you're shortening a little bit on that right side. And just hold this with adding those sternal breaths. Inhales, you keep your hands as they are so that they do not rise with the sternum. And on the exhales, you allow the hands to assist the sternum to sink a little more towards the floor, a little more in towards the spine. One more breath. Untilt the head, bring it back to face center, switch the hands if you'd like. We'll do the same thing to the other side. So first we're going to slightly, not our maximum at all, not even 50%. We're going to turn just slightly to the left for you. And then helium balloon is on your right ear to add that slight tilt so that you're shortening a little bit on that inside side of the neck. And then your sternal breaths for 3. I know it's always tempting to look at the screen when you're following an online class, but as often as you can during the class, either close your eyes or look anywhere else but at the screen, because when our eyes are engaged like that, our nervous system is on high alert, and we don't need it to be. I'll try to make my cues such that you don't have to see me too much. Untilt the head, come on back to the center, release the hands. We'll do that same little movement. Turn the head to one side. Any change in the quality, any change in the ease of movement, any change in how far you can go easily. Last tilt. And we'll do one last one. So hands on the sternum again. This time, you're going to mirror me. So let's tilt our head to the right. Then you're going to turn your head a little bit to look towards the ceiling with your eyes and nose. And then lift the chin a little bit towards the ceiling. This one you're going to feel a little bit more than the ones we've done previously. You're going to feel it along the front and side of the throat. Same sternal breaths as we hold here. Try not to be looking at me. Either close your eyes or just gaze wherever your eyes are landing as your head is in this position. But if you try to look at me while you're doing it, you're going to engage the muscles of the neck, which is part of what we're trying to release, so it's kind of counterproductive. To come out of it, we're going to come out of it one piece at a time. So first the chin comes slightly down. We turn the head to look forward and we untilt. You can switch which hand's on top just to change things up. Tilt your head this time to your left. Slightly turn the eyes and nose to face the ceiling. Slightly tilt the chin to the ceiling. And again, these ones you'll feel maybe a little bit more than you had on the first couple. Go to your sternal breaths to deepen it a little bit. Avoid the temptation of looking at your computer or your iPad or your phone, and just let your gaze fall wherever it does naturally with your head in this position. Or you close the eyes, which is even better. Come out of it one piece at a time. So first we bring the chin down, turn the head to face the front, untilt, and release the arms. Last little test, we'll do the same movements we had done at the beginning. So turn your head to one side, back to center, other way. Nice change in my body. I hope you see a little bit of a change in yours. Sometimes we need to repeat them a few times before we do see that change. And come on back. Okay, before we go to the next one, I just want you to take a moment to just let your spine be loosey-goosey. Just let it be. If you've been sitting, feel free to stand up and walk around for a moment. Sometimes when we get focused on head and neck movements, the rest of the spine, without even realizing it, we get really rigid to support ourselves, and just give that a break for a moment. So nothing specific, just give it a break. And then in your seated position, close the eyes and just revisit how your head is sitting on your torso. Does it feel like it's sitting any differently than when you checked in at the beginning? There's no right or wrong answer, but whatever the answer is, just notice it for yourself. And open the eyes. Okay, so the next thing we're going to go to. So I had written when I posted this class that we're focusing on neck and shoulders, and we are, but I always want to be careful of saying stuff like that, because although we might be bringing in certain movements that maybe focus a little bit more on those areas, the body is really one body. It's all connected. We're not separated into parts. So even though, yes, we may be doing a few more neck and shoulder exercises than pelvis today, we're still affecting the entire body right down to the toes, okay? So keep that in mind as you do these next ones. If you've been sitting already and you want to change what version of sitting you're in, go ahead. I'm going to do that myself. I'm going to switch to kneeling, and I'm going to use this ball to show you. So with all of the work online that everyone's doing, it's kind of highlighting that issue that many of us have of being a little bit rounded through the chest and shoulders. So we're going to address that. We already did with the ones that we just did together, but we're going to address it a little bit more. I'm going to go on a diagonal so you can see me a little better. One of the things that happens is if we're a little bit rounded through the chest and shoulders, and I'm going to exaggerate. So imagine you're a bit rounded because life is often here for us. As humans, we always want our gaze to be looking at the horizontal horizon. So if our spine and shoulders are here, we have no choice but to lift the head so that we can see what we're doing. But look at what that does to the back of the neck. It shortens those muscles at the back of the neck. So we're going to try to address this aspect of how we hold ourselves with these three exercises. So before we do that, before I guide you, I'd like you to exaggerate a rounded upper back, rounded shoulders for just a moment. Notice how that feels in your body. And then without looking at me, I'd like you to correct it. What would you do if I just asked you to open up through your chest and shoulders? What would your strategy be? So for a couple of times on your own, go from that rounded position to what you would consider an open chest, open shoulder position, and just notice, what did I do? How did I get there? What did I change to go from being rounded to being open? And then we'll go through a few options together. So typically there are three factors, and we'll take them one at a time. So I'm going to use this happy face on my breastbone to depict one aspect. So one aspect is that we might be rounded through the actual spine. So instead of our spine looking forward, if we're rounded through here, it brings our sternum to look down at the floor. So you go ahead and do this part with me. We're going to think of using the muscles alongside the spine to lift the heart just enough to bring us to neutral. So we're not looking to go into a big arch. We're just looking to bring ourselves to neutral. Pause there for just one breath cycle, in and out. And then allow yourself to fall into what your normal is. So maybe you're not rounded at all. So whatever your normal is, you let yourself fall into it. I'm exaggerating it just so that you have something to see. So right now the eyes are looking at the floor. I'm going to use the muscles alongside my spine to bring my sternum and my heart to look straight ahead. And notice, how does that feel in my spine? How does that feel in my head? Do that a couple more times at your rhythm. I'm exaggerating it, so you don't have to go as round as me. Go to what your natural posture is, and then from there, just by addressing the spine for now, bring it a little more neutral. And it's likely quite subtle. One last time. We have a strip of muscles that run parallel to the spine on either side that go from the base of the skull all the way down to the tailbone on the paravertebral muscles. So these guys are really key that we want to use them to bring ourselves back up into this position. So that's one aspect. Second aspect, we're going to look at the shoulder joint itself. So the arm bone is called the humerus, and it sits in a ball and socket. It's a ball which sits in a socket of the shoulder blade, and that together makes the shoulder joint, the glenohumeral joint. So in a perfect world, the front of our shoulder bone, that ball of the shoulder, would be looking straight forward like this happy face is now. But for many of us, it's actually turned towards the inside. Again, most of things that we do in life, almost everything we do in life is in front of us. So these muscles in the front get shorter, they get stronger, and that pulls us into that position. So we're going to work on the muscles that do the opposite. So we're going to roll that ball that is the shoulder in the shoulder joint to get this happy face either looking forward, or maybe for some of you, we're going to get it to look towards the outside, okay? You could do this with your arms hanging by your side, but we tend to fool ourselves when we try this. We have this ability called supination pronation in the forearm. So what a lot of us do, try this with me. When the arms are by the side and we want to open up to the shoulders, my sleeves are too long. What we often do is we'll turn our hands and our forearms to look way to the outside, but often the ball of my shoulder is still looking inwards. So we've actually not changed anything in the area we're trying to. So in order to get away from that cheat, you're going to place your hands like this as though you're holding a tray on your palms. And you're going to do that rotation through the shoulder from here. So you go ahead a few times at your own rhythm, opening, pause for a moment, coming back to the middle. I'm going to demonstrate with this ball at the same time. So as I open, I'm turning the front of the shoulder to look to the outside, and then I come back. Turn it to the outside, and I come back. Let's do that one more time. Turn it to the outside. Now hold it here. And just for a few breath cycles, this time we're going to bring our breath down to our lower rib cage. As you hold this external rotation of the shoulders, where do you feel the work? So the longer we hold, the more you're going to feel the area just at the back of the shoulder that starts to might get a little hot, might even burn a little bit, it might feel like a deep ache, and release it all. Just let that all go, let your spine, let your shoulders just do whatever feels good to you, nothing specific, just move in whatever way your body feels it needs to move. So those muscles we were just using are behind the shoulder. They're the rotator cuff muscles that turn the ball of the shoulder joint in its socket. So we addressed the spine, we addressed the shoulder joint. There's a third aspect, the shoulder blades. So we're gonna go in what we call scaption. So your arms are not fully to the outside. They're not fully in front of you. They're about halfway in between at about a 45-degree angle. You're going to slide your shoulder blades forward, so it's like your arms get longer, and then use the muscles in between the shoulder blades to kiss them towards the spine in the back. Hold that for just a breath cycle, and then again slide the shoulder blades away from the spine. Notice how that feels, and then use the muscles in between the shoulder blades to draw the shoulder blades towards the spine. One more time, slide them away from the spine, slide them towards the spine. We're going to hold this one now for about 3 breaths. Send your breath down into your lower rib cage, and notice how the work you feel right now is in a bit of a different area than when we were doing this rotation action. When we were isolating that shoulder rotation, you likely felt it more at the back of the shoulder. As we're holding this shoulder blade action, you're likely feeling it in between the shoulder blades closer to the spine. And let it all go. Take a moment to do whatever you need to do to give your spine, shoulders, head, neck a break. Now let's put all 3 of those together. So exaggerate your rounding this for a moment. Imagine you've been working for hours at the computer and everything's kind of rounded forward. So we're first going to lift from the heart to bring that into a neutral alignment. Then we're going to hold our platter, rotate the shoulders. Once you've got that rotation, you can go ahead and let the forearms drop. And now with the arms in this position, kiss the shoulder blades towards the spine, and for 2 breaths, hold these 3 actions together. And notice how much work that is. They're small, subtle movements, but because they're so different from what we do for so much of our day, these muscles tend to get a little bit lazy, a little bit too long, a little bit too weak from lack of use. And so it doesn't take much to wake them up or make them feel tired, and let it go. Let's do that again. So exaggerate the rounding. You're going to first roll the spine so that the heart and sternum look to the front. Then you're going to externally rotate the shoulders, Once you've done that, you can let the arms fall and then add the shoulder blade action, kissing the shoulder blades towards the spine. Hold that for 2 breaths this time. Try to fill into the rib cage on your breaths. And let it all go. One last component. So often, if we're used to being here, a reminder that the head often does this. So now if I fix my chest, fix my shoulder, fix my blades, sometimes the head is still not quite in the right position. So the other aspect we're going to add to it is what we call either an OA nod, or sometimes it's referred to as a chin tuck. It's actually a combination of 2 movements. So you can have a finger on your chin, I find that helpful. Slide the chin slightly back like you're closing a drawer, but at the same time, it's like someone's pulling on the back of your hair. So I'm going to exaggerate that. From a forward head, I'm going to slide the chin back as I lengthen through the base of the skull. Go ahead and do that on your own for 4 times, but much smaller than what I just did. So you may have spent 30, 40, 50, 60, 70 years with your head forward. We don't want to exaggerate too much bringing it back so that we create a rigid spine. Do that action, but think of yourself as a bobblehead so that once you're in that neutral alignment, you still got space to play, to dance, to have some freedom. One last time with that little chin nod. And let it all go. Do whatever you need to just give your spine a break. Maybe stand up and walk around for a moment, change positions. So putting those all together, lifting the heart, rolling the shoulders, sliding the blades, chin in line. That's something that we can do periodically throughout the day, but don't hold it for very long at all. It's taking you your whole life to develop a particular posture. We can't all of a sudden hold this good posture and keep it there. And what is good posture? That's a whole other discussion. But you don't want to go and introduce something new to your body and force it to be there for too long. It's going to take time to create a new habit. So what I suggest to people is take that nice position, hold it for maximum 3 breath cycles, and then forget about it for an hour. But maybe every hour you can do that again, and you'll start to find that it won't be so challenging after you've done it for a couple of weeks in a row. Okay, next one. You're going to still be in seated, but change your sitting position if you don't like how you are. Let's place the right hand behind the head. Other hand is going to be resting on something, so on your chair or on the floor, depending on how you're set up. We're going to lean the body over to one side so that you're really opening through the armpit and the rib cage on that right hand side. Just a couple of breaths, fill into that space. Every inhale, see if you can sense the ribs opening up away from each other. And on every exhale, see if you can notice them getting a little closer together. On your next breath in, you're going to spiral the heart towards the ceiling, lifting through the heart. On the exhale, round through the upper back, face the floor, and bring elbow to elbow. So inhale, heart lift, spiral to the ceiling. Exhale, round to the upper back, face the floor, and aim elbow to elbow. Inhale, heart lift, up to the ceiling. Exhale, round and down. Come on back up to center. Come on up tall. And same thing on the other side. So make sure that your hand is supported on something. Other hand behind the head. If hand behind the head is not available to you, it's no problem to have it here, or to keep it by your side is fine. Go over to one side, just enough that you feel some opening through the armpit, through those ribs, and just spend a couple of breaths really filling into the lateral rib cage. Because our arms are by our side for a lot of the day, this area can get congested. So it's really nice to open it up, bring some awareness and some breath, some movement to it. Next breath in, spiral to the ceiling, lift through the heart. Exhale, round the upper back, face the floor, elbow to elbow. Inhale, lift and spiral to the ceiling. Exhale, round and spiral to the floor. One last time. Inhale, lift and spiral to the ceiling. Exhale, round and spiral to the floor. Face the front. Come on up tall. We'll do one more version, bringing the shoulder into play a little bit more. So with your right arm, you're going to take your arm behind your back. That's not comfortable or accessible for everyone. So if it's not comfortable for you, you can place your hand on your hip or you keep it by your side, okay? It's fine if you feel a pull in this position, that's normal. From here, you're going to have your other hand on the support. You're going to lean away from the arm that's behind the body. Notice how it's the same stretch we just did, but it feels very different all of a sudden because our arm and shoulder are in such a different position. Now you're going to spiral the heart a little bit towards the ceiling. Now we're going to do the 3 actions we had done for the shoulder and to open the chest. We're going to lift the sternum. We're going to roll the ball of the shoulder to face open, and then we're going to kiss the shoulder blade towards the spine. And pause here for 1 full slow breath cycle. Slowly come out of it and back up tall. So it's essentially everything we added up together before, but when you add a little twist, it feels completely different in your body. So you're going to place the other hand behind the back. Maybe one side you could do that, the other side you can't. So be open to changing it up, or doing nothing with the arm is also fine. So we're first going to tip the body away from that arm. And just notice how different that feels than when we had the arm up overhead. Like it's a different exercise all of a sudden. Slightly turn the chest and head to face the ceiling. Now the 3 actions we had done before. Lift through the heart, spiral the shoulder joints so that the happy face points outside, and then slide the shoulder blade towards the spine. Pause here for 1 full breath in, 1 full breath out. Gently release all of it and let everything go nice and loose. We're going to take it down to the floor now. So you can maybe have some of your props ready. Have your towels nearby, your balls nearby, just in case. For some of you, you might find that when you're lying on your stomach, you need a little bit of support under the abdomen. And if that's the case, then I recommend folding up a towel, and you can place that under your abdomen. And sometimes you might need to play around with how much support you need. On some days, you might need a lot. On some days, you might not need any. Play with it and see. I'm loose. Okay. So now we're going to lie on our stomachs. Actually, before I get there, last time we did stuff on our stomach, people were asking about cramping in the feet. So your face cloths are great for this. You can fold up a face cloth and roll it so that when you lie on the stomach, I'm just going to go in 4-point here to show you, but imagine I was lying on my stomach. You want to place your roll not under the foot itself, but under that bend at the ankle so that you're supporting that part, but your toes are still touching the floor. How much support you need is different for everybody. Some of you might need something much more intense, like so. So you play around it and see what support you need, but keep in mind, you want to support enough so that you're not cramping, but you don't want to support so much that you're never ever going to change that issue you have at the ankle. There's a saying we have in the pain care world, challenge it to change it. And this is a great example. Yes, you want to give it the support so you're not cramping, but you also want to challenge it a little bit so that over time you can build some more movement in that ankle. Hopefully that makes sense. Now the other issue is that if you're a woman and you have breasts, or if you're quite rounded through the top of the spine, lying on your stomach, what can happen, if I just let everything go, my shoulders really fall forward into the floor, and that's not a lovely sensation for my neck. So here, balls, folded up towels, or small pillows work great. So the arms are going to be in this position. If you need that support under the shoulders, I highly recommend it. It's very, very helpful. I'm just going to give you, if you need something under the abdomen, go ahead and put something there. Make sure it's all you need, not more than you need, okay? And I'm actually going to stay seated for this first section so that you can hear me easier. You guys will stay lying on your stomachs. So you're going to have the hands like so that the hands are beside the face. If you need something on your forehead, you can again use your folded face cloth or towel there if need be. But we're not staying there, so you might not need it. You're going to lift the head only enough to clear the nose, turn the head to face one side, let it come down to rest. And you're gonna alternate sides a few times at your own rhythm. So each time you're only lifting the head far enough that the nose clears the floor. Let it come to rest on the side of the head, and you alternate sides. Just do that a few times. Notice how that feels. How much freedom do you have? How easy it is to lift? How challenging is it to lift? Just notice. And then you're going to come to rest with your head facing the camera or facing your screen, whatever that means for you. It doesn't matter if it's right or left. Eyes closed. I'm going to guide you through this part. You don't need to see me for it. It's very small, subtle movements. So I'd like you to do the action of bringing your chin towards your chest. So your head is turned to one side, the head is resting on the floor, your head is facing your screen, and very small, you're just going to slide the chin towards your chest. So I'm not even doing that action, so don't worry about looking at me. Just see what is your strategy when I say nod your chin towards your chest. Do it a couple of times, always keeping the support of the head on the floor. You're not looking to lift the head at all in this one. You want that support. And then pause in the center. In the center meaning you're still with your head turned to the side, but you're not nodding. Second set, you're going to think of nodding your nose towards your armpit. So it's exactly the same movement, but we're initiating it from a different place. Just go for 3, nodding your tip of your nose towards your armpit, all the while keeping the head supported on the floor. And then pause. And lastly, you're going to nod your chin towards your shoulder 3 times at your own rhythm. And just notice how those are 3 of the exact same movement, but when we initiate from a different part of the body, or we think about it a little bit differently in our mind, sometimes that can completely change the physical experience we have in our bodies. Pause. You're again going to lift the head, turn it to the other side now. So you're going to be facing away from me. Eyes closed, and explore those same 3 versions. So at first, you're going to be nodding chin towards your chest 3 times, nice and slow. Pause. Next, you're going to nod tip of your nose towards the armpit. And then pause. And lastly, you're going to nod the forehead towards the shoulder 3 times. And again, notice that even though it was the exact same movement all 3 times, maybe it felt a little different in your body when you initiated from a different place. It's a good reminder that just how we think about things, what we focus on, can completely change the experience that we have in our bodies. And then pause. Okay, so now if you did not already have something under the abdomen, this time I'm going to ask you to very purposefully put something under the abdomen. Just clear some space here. I have this prop that I quite like. You absolutely don't need to have this. I'm sure most of you don't, but if any of you are interested, it is a nice tool, very inexpensive. So I could always give a link to Jen to share with you guys afterwards. So I'm going to use this just because I think you'll see better. But for yourselves at home, I would just take a towel and fold it. How big depends on you. I would like you to have a little bit of lift under the abdomen so that your hips are not fully in a straight line, but rather they're slightly bent, okay? So if I were to use this towel, for example, I'll fold it twice, and then I would probably go about that thickness, okay? I'm not using the towel though. I'm going to use this. I think you'll just see better. So here again, if you're someone whose shoulders are quite rounded, go ahead and let something rest under your shoulders to support that. I'm actually going to stay upright like this just so that you guys can hear me, but please for yourselves, keep everything resting on the ground. What I would suggest is one hand over the other with your forehead resting on your hands. If that's not comfortable, fold up a blanket and put that under the forehead, okay? So I'll try to do this. So my head is turned towards you just so you can hear me, but you guys are gonna have your head looking down on the floor. With the left leg, you're going to press into the tops of the feet, just enough so that you can hover the knee off the floor. I don't know if you can see that with my looser pants. Pause there and come on back down. And again, if you need that little roll under the front of the ankle to prevent cramping, go ahead and have that there. So press into the top of the foot, hover the knee off the ground. Notice how the lower part of your glutes around your sit bone turns on a little bit and come down. Tuck the toes under that same foot. We're going to do the exact same action. Reach through the heel till the knee hovers. It's the same movement, but we go a little further now. So feel how that will turn this area of your glute on even a little bit stronger. And let it go. And again, as you do these, if you feel any compression in the lower back, then I would suggest folding up your towel one more time. So now we're going to keep the knee hovering off the ground, and you're going to windshield wiper the heel in and out. But what's happening is we're rolling the hip socket now, very similar to the ball and socket of the shoulder. Now we're rolling that hip socket, the femur bone in the hip socket, I should say, and let that go. Tops of the foot presses down, same leg, press, and this time you're going to lengthen to lift that leg slightly off the ground, just a couple of inches. Hold for a moment, and come back down. One last time. Press into the foot first, lengthen so that the leg hovers off the ground, pause, and come back down. Now, you guys already had your head facing the floor. You can keep your forehead resting on your fist of your left hand. Your right arm is reaching a little bit overhead on the diagonal. Pinky side of the hand is into the floor, and we're going to lightly press into the floor. So my left leg, push the top of the foot into the ground. As I lift the leg, I'm at the same time pushing into that right arm to hover my chest and head. So the head is actually doing that same chin tuck action, or the OA nod, that we had done in standing. Slowly let it all come down. One last time. Press into the top of the foot. Press into the arm. Lift slightly through the heart. OA nod or chin tuck through the head, base of the skull. Pause and come down. Let both hands come under your forehead and just shake your tail. If you were a dog, imagine that you're wagging your tail for a moment just to release everything through the lower back. You guys stay in the same position you're in. I'm going to just switch to the other side so that it's easier for you to see me. So you're going to start by pressing into the top of the right foot until that knee hovers off the ground. Come on back down. Same thing. And so again, my head is turned only so that you guys can hear me well, but it's much better for your neck if you keep your head facing the floor on these, okay? Tuck the toes under, reach through the center of the heel and hover the knee off the ground, hold. Come on back down. Notice that now that the leg is going a little bit higher, the glutes right around the sit bones turn on just a little bit more. This time, keep the leg lengthened and rotate from that hip socket to windshield wiper the heel. In and out. And let it release. Make sure your head is neutral. You're going to have your forehead resting on your right fist. Your left arm is lengthened a little bit overhead, but out on the diagonal. Pinky fingers on the ground. Press into the top of your right foot. Oops. Lengthen and lift. Sorry, we're doing just the leg first. Hold for a moment. Come back down. One more of just the leg. Press into the foot. Hover the knee. Lengthen to lift. Slowly down. Now we're going to add the upper body to it. Press into the top of the foot. Hover the knee. Lengthen. Press into that left arm just a little bit. We're lifting through the heart. We're doing that chin tuck, that OA nod to the base of the skull. Hold for a moment. Slowly control all the way back down. And we do that one last time. Press into the top of the foot. Lengthen to lift. Hover the chest. Hover the head. Pause there for a moment. Slowly come back down. Place your hands underneath your lower ribs, or beside your lower ribs, sorry. Push into the hands and sit the weight back into a child's pose. You can place one fist on the other to let your forehead come to rest on your hands. If that's not available to you, just come up to kneeling. We'll do one last thing together. So you're going to be on the hands and knees. Here again, if you need that little bit of support under the front of the ankle, you go for it. Set yourself up on the hands and knees, equal weight between the hands and knees. Hands are under the shoulders, knees are underneath your hips. And then you're going to bring one knee about 3 inches forward and the opposite hand about 3 inches towards the center. So we're diagonally towards the center with one hand and opposite knee. From here, press into all 4 limbs to round through the spine and all 4 limbs to extend through the spine. Go ahead at your own rhythm 3 times, back and forth in this nice cat-cow action. Noticing that it might feel a little bit differently because we've got the arms and legs set up a little on a diagonal. Pause in the center, bring both hands under the shoulders, both knees under the hips, and then we're going to do the opposite arm and leg. So bring the other knee towards the center with the opposite hand towards the center. And go ahead for 3 more at your own rhythm. Round through the whole spine, extend through the whole spine. 2 more times at your own rhythm. Bring the hands and knees back in line with your body. Walk your hands back to come to kneeling. Sit your bum on your heels. We're going to finish with one last breath exercise. So up to you if you want to kneel, if you want to sit on the ground or in a chair, or if you would like to lie down. I'll just give you a moment to get there. Support yourself however is best for you today. So I don't know where everybody's watching from, but I'm teaching from Montreal, and it's actually quite fine today, but we've had quite a heat wave the last couple of weeks. So I put in a cooling breath to end with today. But even if it's not hot in your environment, if we have any heat inside the body from inflammation, from anger, anything like that, this is a great breath exercise to calm that down. So it's called the Shitali breath. So you have 2 options. So with the tongue, we want to create a straw out of the tongue. So the position of the tongue is like this, where you curl the sides of the tongue and you're going to be bringing the air into the hole. Now, not everyone is able to do that action, so go ahead and try it for a moment. I'll demonstrate it again. You're actually going to keep the tongue in the mouth, but I'm just sticking mine out so you can see what I'm doing. If that's not available to you, you'll instead put the tip of your tongue at the back of the front of your teeth. And so if you're doing the first version, you're going to be bringing the air into that tunnel you're creating through your tongue, almost like you're bringing the breath into a straw. If you can't do the first version and the tongue is on the back of the front teeth, you're going to be bringing the air into the sides of the tongue. So either way, the mouth is a little bit open, different from a lot of the breaths we've done together. This one, we're going to breathe in through the mouth, out through the nose. I'm going to go ahead and start it with you now. We're going to move for 6 breaths at your own rhythm. I'll demonstrate just the first couple. Take a breath in first just to get ready. Take a breath out to prepare. Keep going at your rhythm. Inhaling through the mouth, exhaling through the nose. Notice how, because we've got the tongue in this position, when you're bringing the breath in, it's actually cooling it on the way in. Compared to when we breathe in through the nose, we're actually warming the breath as it's coming in. So on those hot days, or on the days where you're feeling inflammation in your body, or maybe you're feeling heat because you're angry or frustrated, pardon me, these cooling breaths can be really lovely. 2 more breaths at your own rhythm. And then just relax the tongue. one full breath in and out without trying to do anything special to your breath. Thank you so much for joining me in today's practice, and I hope to see you again on Monday for the last class before we take a break for the summer. I'll hand it back to Jen.
Thanks, Colleen. That was a lovely practice. I know that people maybe had a couple questions during, just during the someone had raised their hand, and so I don't know.
Oh, okay.
I want to ask that question now, or if anybody else has any questions. Please feel free to put them in the Q&A. So I'm not going to unmute people to talk, but if you want to put it in the chat or the Q&A,
Okay.
I'm happy to do that. So we'll just give it a minute.
Absolutely.
Yeah. You've had a heat wave?
Oh boy, yes. Have you guys had the same or what?
We have not.
No? We had a lot of humidity the last 2 weeks, but we were complaining about cold the couple weeks prior, so we really can't complain.
No, that's right. I know, it's always one or the other, isn't it?
Exactly.
Yeah. Okay, people are still filling out the poll.
Okay.
And I'm not seeing any questions. So that may mean you answered the questions. It was sort of when you were on your stomach and just going into that movement, which I know was, people were concerned about that one last time. So
because of the feet action, Jen, was it the cramping again?
Well, I'm not sure. I'm not
Okay.
sure. But yeah, I think there was a couple things, couple challenging pieces to that movement. But anyway.
Okay.
We did explain it this time differently, and so I think it addressed a lot of those questions. So,
and if anybody's interested, Jen, I don't know if you can see this that I'm holding up right now, but this arc I find really helpful, both for being on your stomach and for other things for the upper back and the other is very inexpensive. So if anyone is interested, maybe they can let you know by chat, and I can send you the link to that.
Is that something you buy online?
Yes, exactly, and I think it was under $15.
Oh.
But it's quite a lovely arc. You know,
Yeah.
sometimes trying to do with our towels, we never quite get the right angle or the right height.
Right.
And I find this is a nice gradual curve. It's not too high, it's not too low. And it works both for the upper back when you're on your back, and it works for the abdomen when we're on the stomach. So, and actually on the side too. So it's a very inexpensive, fun little tool. If anybody's interested, I can send the link.
And it sounds quite versatile.
Yeah, it is.
Yeah, that's great. Okay, Colleen, there are no questions.
No questions? Okay.
So, I'm gonna end the poll. Thank you for everyone for coming. And oh, hang on. Oh, someone would like the info on that prop.
Okay, perfect.
Yeah.
I'll forward that to you.
Okay. Well,
Not to you. Do you want me to?
Maybe just put it in the chat right now if you can. Are you?
I don't even remember what it's called. I know I got it from Fitness Depot, but I don't remember what they call it.
Okay.
And I think they have different sizes. What I could do, what about when I teach on Monday? Could I let people know then?
Yeah, bring it on Monday. And then I think probably if folks were keen to look it up, you could just go to the Fitness Depot site. And
fitnessdepot.ca.
And then just have a look for that kind of a prop.
Exactly. I'll show it one more time. It's not a very high. They do have a higher version, which is good for some things, but this is the one that would suit most people.
It's really low, right?
Yeah, it's really low. It's maybe 2 inches in height as maximum.
Right. Okay, that's important. All right, that sounds great. Thank you. Thanks, everyone.
See you on Monday.
Have a great weekend, everyone.
Have a good weekend.
See you Monday.
Bye.